What are injectables?
The injectables, when patients are looking for some enhancement or correction of something minor, are really the realm of injectables. And injectables, what we're really talking about is Botox and fillers. They're two different products. Botox, in short, is a drug that you inject through the skin into the muscle, and it paralyzes the muscle. And for a short period of time, about 3 to 5 days. And filler is injected into the skin or deep to the skin, and it's usually from the eyes down, cheeks, lips, nasolabial folds, marionette lines, and things like that.
Explain the options of injectables and what they do.
The fillers are semi-permanent. There are different kinds of fillers. I typically use the hyaluronic acid fillers, which is a naturally occurring sugar. Typically about 6 months to 12 months, and it depends on how much filler is being injected. Obviously, if somebody injects 1 syringe of filler, it'll take your body less time to reabsorb that than 2 syringes, and each syringe is typically 1 cc.
Who is not a good candidate for injectables?
Patients that don't do well with fillers are patients that have such loose skin that you can put all the filler in the world and it's never going to correct the lines that they have on their face because it's too loose, and what they really need is probably a surgical procedure. But some patients don't want surgical procedures, so they'll rather take some minor improvement than a surgical procedure.
Is there an advantage to doing injectables before you consider surgery?
The advantage of the injectables is that the patients are able to see the minor results and improvements in their facial features without having to undergo a surgical procedure. And for a lot of patients, that's enough. You know, they don't want anything major or any changes in their face, and would rather just have subtle improvements. And that's really the advantage of injectables.
And at what age do you tend to see people come in looking for something short of surgery?
Typically for Botox, it was pretty rare at one time for me to see somebody in their 20s. But I see patients in their 20s all the time, because what they're doing now is that they're using Botox as a preventative measure to prevent permanent lines from appearing on their faces, such as deep grooves either between the brows or the forehead or in the crow's feet. So we're seeing patients in their 20s all the way up into their 60s, 70s. But Botox is somewhat age dependent. The best responders are patients under 50. About 92% should be able to respond to Botox, meaning it will actually paralyze the muscle that's being treated. Between 50 and 65, you drop off about 10%, so about 80%. And over the age of 65, as many as 60% may not have the results or have response of muscle paralysis for the areas treated. But if you're 70, you probably need a surgical procedure and not an injectable like Botox. When it comes to filler, the fillers are usually, again, 20s, 30s, 40s, 50s, 60s, 70s. The 20-year-olds typically like their lips enhanced. The 30-year-olds typically are starting to have those fine lines and wrinkles around the mouth that they like to improve. Same thing with the 40, 50, and 60-year-olds. By the time the patients get into their 60s, they probably want a facelift result with an injectable, but they won't get it, and I will tell them so. And I try to tell them, you know, with a facelift, you can probably get more permanent, better results than with injectables. Botox and filler have their roles, and I think they're really good for the 20s, 30s, 40s, 50s, even 60s. But once you get into the 60s, 70s, you probably need a surgical procedure.